Hello everyone, and welcome to the Journal Club. Today we'll be discussing a very recent clinical trial published in International Endodontic Journal in 2025. The paper is titled with Therapeutic Irrigant Procedures for Treating Apical Periodontitis, a triple-blinded parallel group randomized control phase 1 and 2 trial, done by Virdee and colleague from University of Birmingham. Apical periodontitis is an inflammatory condition of the periodontium that affect overall half of the global adult population. Despite the advance in the endodontic materials and technology, the success rate of root canal treatment in necrotic teeth with preapical radiolucencies have remained unchanged for decades. Although the current therapeutic strategies are focusing on the antimicrobial disinfection using sodium hypochlorite, recently researchers are exploring more biological approach by the use of the regenerative potential of dentine extracellular matrix component by the help of EDTA irrigant to release the dentine matrix, and which could stimulate the mesenchymal stem cells in the periodicular tissues and enhance the healing. This trial are aimed to compare the clinical and radiographic outcome of root canal treatment with conventional irrigant regime of sodium hypochlorite and equivalent to those promoting the release of dentine extracellular matrix in mature permanent teeth diagnosed with necrotic pulp and asymptomatic apical periodontitis. And they also want to assess the patient-reported pain score between irrigant regimes and the periodicular tissue fluid analysis to explore if the irrigant regime differently influence the periodicular inflammatory mediators profiles, and also to assess the periapical lesion volume change between two irrigant regimes. It is a triple-blinded, randomized control phase 1 and 2 trial that done between 2019 and 2024. They had 40 single-rooted necrotic teeth from 37 healthy patients that equally divided into two groups. The control group of 5.25% of sodium hypochlorite and interventional group of 17% EDTA irrigant. And all other aspects of endodontic protocol were standardized over 2 visits with 14 days of calcium hydroxide intracanal medicament. The treatment outcome were clinically and radiographically assessed with a CBCT at 1 year, and the patient reported pain score were recorded at 6 hours and then 24 hours for 1 week post-instrumentations and 14 days post-obturations. And the BTF analysis were collected pre-instrumentations and pre-obturations. The result at 19% recall rate were achieved at 1 year in both groups. The participants are most commonly experience pain 6 hours post-instrumentation stage, and the pain severity in post-instrumentations was milder to moderate in EDTA group than sodium hypochlorite group. However, the most patients reported no pain or mild discomfort after obturations. And based on the CBCT image and loose criteria, the favorable outcome were observed in 89% of the treatment using sodium hypochlorite and 94% of the treatment using EDTA irrigant. And the median lesion volume reduction of 92% in sodium hypochlorite and 95% in EDTA group, with no serious adverse effect or atypical pain pattern were reported. And targeting 48 panel consistently detecting 15 inflammatory analytic in both groups, all of which reduced in the pre-obturations. However, at this stage, interleukin 6 and 19 were significantly more abundant in the intervention group. So as a conclusion, this study showed that the use of therapeutic irrigant regime that promoting the dentine extracellular matrix that can result in 1 year treatment outcome are equivalent to those of conventional irrigant protocol with no serious adverse effect reported. Thank you.